Hello, everyone, and welcome to this SMITU webinar. My name is Dennis Orthman. I am the Associate Executive Director with SMI, and I'll be the host for today's session. Today's webinar session is just one of the resources produced by the SMI initiative team that worked on the topic of supply chain servicing the continuum of care. As healthcare systems shift their focus to broader population health efforts, care is being delivered from multiple locations to meet the emerging needs of patients. This transition is a significant challenge for the traditional acute care-centric supply chains. The SMI initiative team, comprised of industry thought leaders from both providers and suppliers, researched this topic and found there are currently many ways that supply chain provides service along the continuum or portions of the continuum of care. One great example is the services provided by Intermountain Homecare, specifically the Intermountain Homecare and Hospice business. Here with us today to provide an overview of the Intermountain Homecare program is Don Bradshaw, Senior Supply Chain Director. Don is an experienced veteran of the healthcare supply chain. He's been instrumental in the continued development and expansion of the Intermountain Homecare program. Don, welcome to this SMITU webinar. I'm sure our viewers will learn much from you.
Thank you. Let's start off, Dennis, by thanking you for letting me do this webinar. This is very interesting, and it'll be, I'm glad to share this information. Let's start off with a little bit of history about our home care and hospice services. We are the longest non-for-profit full-service home care service provider in the Intermountain West, and I will give you a little bit of a brief overview. The picture you're seeing here is our new facility we opened in July of 2014, and you can see that our building is kind of segregated. We have our offices up front, we have our segregation in the middle, which is our high-end wheelchair shop through the middle. Then that big cement piece you see is our actual fulfillment center that we distribute product direct to the patient from. So just a quick history. It's pretty interesting. Intermountain Homecare and Hospice, our services actually were established in 1984. And 10 years later, we decided to bring all of our home health hospice and all the medical equipment and infusion and all of our pharmacy combined together in one location to be a full service home care provider that you can get all your products and services at one location. We were in West Valley City, Utah for about 15, 20 years. And then again, we moved to South Jordan, Utah in 2014 to our new location. Our service area, this is a map of the Wasatch Front. And as you can see, there's an I-15 corridor that runs north and south. These are really our main population areas. So you see from Ogden to Provo is where the main population is in Utah, and then that population down through the corridor into St. George. We've decided as a company and as Intermountain Healthcare that we were going to provide in these rural areas because the services there just weren't as robust as they needed to be. So we've gone down to these outlying locations and created home cares in these locations to provide service in the home because there's really not any big hospitals or other services out there for folks in the community there. So let's talk about home health. In our home health, we have adult and pediatric nursing. This is our nursing in the home. All of ours, we have CNAs, the certified nursing assistants, that actually accompany nurses and other healthcare providers in the home. And then we have all our rehab services that we provide in the home, social services. And hospice is one of our shining stars in Intermountain Homecare and Hospice. We do everything from pain management, end-of-life planning, family education, all the support that you see there on the screen, but we also support the family, and that's really important. We're not just supporting the patient in the home, but the whole support for the family as this end-of-life process proceeds through. through its progression. Home medical equipment. This is all types of product provided in the home plus more. We have everything from breathing apparatus, so your CPAP, BiPAPs, ventilators. We have kids on ventilators in the home, so they don't have to be in the hospital. All of our products are portable. You can take them with you, so these parents can take their children and go do activities, and all the other devices that were provided in the home. We also have, when we talk about education and support, we have respiratory therapists, physical therapists, occupational therapists, and then REAs, which I'll talk about a little bit into the presentation later, that provide not only education and support, but any other type of questions and equipment, specialty equipment that these patients may need in the home. Our home infusion therapy, we compound drugs, which we have antibiotics, nutritional, chemotherapy, pain medications, hydration, immune therapy. We have an infusion. Room that you can come into home care and stop in and get your infusions. You don't have to do it in the home, but a lot of times after the doctors create their prescriptions and you've gone through the hospital system, we'll take you into the home and go through and provide these drugs and supplies for you. So you don't have to go to the hospital. You can stay in the home or at work to have your infusions done.
Wow.
So some points of interest, we do have about 1,100 employees, and we are from Burley, Idaho, all the way to St. George, Utah, which is about 450 miles. We do have the largest custom wheelchair mobility shop in the Intermountain West, and I like to emphasize the mobility piece of that. We don't just do custom wheelchairs. We do all types of mobility products. At any given time, we have close to 98,000 patients served annually. That's growing all the time as we have more and more telephony and different types of ways to monitor patients' vitals and things in the home. So that patient part of that is really, really growing. We do about 34,000 patient visits per month. And that includes everybody, all the different types of services we provide. We do have a lot of vehicles. We have about 104 vans, and they're all types of different delivery equipment we have. And we do a little more than 1.9 million miles per year. We do a lot of deliveries. That comes down to about 400 to 600 deliveries per day. That includes all the packages we ship too. And again, we do about 7,500 packages shipped every month. That includes incontinent products, feeding, pharmaceutical supplies, and different types of equipment. Intermountain Homecare, the SCO part of this, on the supply chain, we manage all the supplies and all the activities and all the deliveries that you just saw in previous slides.
Don, this is Dennis. So just to clarify, you're pretty much a freestanding company versus
Absolutely.
Supply chain. Okay.
Right. We are, Homecare is a division of Intermountain Healthcare.
Thanks, Don.
Okay. Some stats on our new building. It's about 45,000 square feet, and that includes our pick lines, our fulfillment center. We do pick product at the lowest unit of sterile measure. So whatever the payer will pay for at that unit of measure, we'll pick down as long as it's sterile. We won't break open pack. We have about 1,300 SKUs in there. There's quite a bit of product in there. We do our own trans filling, so this is pretty unique. Outside our building, we have about a 15,000 gallon liquid oxygen tank, and in this bottom picture, you can see the piping coming in from the back. We take that liquid, bring it in, and turn it into a vapor and compress it into these cylinders, and we do this ourselves. We have about $36 million in assets and equipment. We manage about $1.6 million in supplies annually, and we have we turn our inventory out there about 1.25 times a month, which is quite a bit. So really, the supply chain is an integrated part of all the hospice and home care activities within the home care setting. So we have REAs, and REAs are respiratory equipment assistants. These folks go into the home, they set up CPAP, they set up newborns on oxygen. We set up all types of different beds and equipment, wheelchairs. So these folks who are supply chain employees provide care directly to our patients. We have our rental equipment assistants. These folks in the supply chain really track all the equipment that we have throughout the system, where it's at, patients it's on, how often it needs to be cleaned, preventive maintenance, all those activities. We do all of our own repairs. Our clinical engineers are trained at a high level. We do our own ventilator repairs and all the equipment that we use. There is no piece of equipment we send out to be repaired. Everything is repaired in-house. We have processing techs, and these are the folks who bring all this equipment in, relabel, clean, process, test, make sure everything's working correctly and that it's ready to go on the next patient. Or if it's new product coming in, they get it processed and ready for patient. We have transportation coordinators with so many vehicles and such a large area we cover out of Salt Lake City. We have coordinators and GPS, and we track all of our vans, and we know where they're all located at any given time. If there's ever a problem, we can look at that real closely and find out why somebody's at a delivery for so long. Again, our material specialists, they're all supply chain folks, and our distribution specialists and coordinators. These are the ones who pull all the equipment, all the drugs, all the supplies, put everything together for that single delivery. In the past, before we had this supply chain center, equipment was pulled for a patient, drugs or supplies were pulled for the same patient, and then they were delivered at 2 separate times. Now everything is put together, and we'll do one delivery to the home or to the patient without having multiple deliveries. This is a huge patient satisfier, so we're not coming in and out of their homes all day long. This is an actual one of our providers, and he knows this gentleman well, and he's just set up this wheelchair. This gentleman also has some oxygen and other services from us. And in closing, this is my last slide. This has really been an interesting growth year for Intermountain Homecare and Hospice. We received an award from the Gardner Chainovator, which was a real surprise and a real honor. And it was recognized for our unique work and what we do at Intermountain Homecare and Hospice. And really what the Chainovator was looking for was innovation in the area of population management and population health. And some of the activities we were doing are really unique to the home care and to the healthcare industry, where we actually have supply chain personnel giving service and healthcare directly to the patients. And I really like what they said at the end there. They will say we're impactful, sustainable, unconventional, which I agree, we're unconventional. We have a huge I'm sorry, Dennis.
No, you're doing good. I was just chuckling at the unconventional comment.
Yes, and our collaboration. The collaboration isn't just with suppliers, but with all of our healthcare givers, all of our nurses, all of our hospice care providers, all of our pharmacists. It's a real collaboration. And everything we do there is measurable. We have matrix on miles driven, deliveries, customer satisfaction. We actually do our own customer satisfaction surveys. We'll do safety inspections. So when one of these folks, one of our REAs goes into a patient's home, we actually do an inspection to make sure it's safe, that oxygen isn't by open flames, that other people in the home aren't smoking, we'll put no smoking labels on the outside of their homes. We'll make sure their dogs can get outside and that the house isn't messy. If we find problems, we bring that back and give it to some of our social worker folks, and they'll go out to the home and help these folks live in an environment that's conducive to their health care.
Don, this is all quite fascinating. I know the first time you and I talked about it, I was really amazed at the integration of a supply chain function in with the clinical function, and also the fact that it's customer facing, meaning, you know, you've got what I would call a traditional supply chain professional staff member interacting with both the patient and the caregivers as part of a team. And I think that's a fascinating aspect of your program.
And that's part of our continuum of care. We want to be sure that from the healthcare giver to the patient, everything is totally integrated in that flow. So we want to make sure not only are our patients taken care of, but our healthcare givers have everything they need to give that care, but also they have a say in what we're doing and how we do it and have an end result.
You know, Don, you mentioned earlier, you were talking about how you fix all of your own equipment. And it brought forward in my mind, there's a part of the culture at Intermountain is to in-source many functions. And I think that your organization is a reflection of that. Is that true?
Absolutely. So with the shipping times and the length of times and the cost of equipment and all those activities combined, we not only save money, but we also turn our equipment quickly so we're not waiting for something to put on patients. And ventilators, as an example, they're incredibly expensive. It's a huge turnaround time. So it was advantageous for us to train our folks. We have the manufacturers in our facilities, training them with all the equipment they need so we can get this equipment in and out, and it's running at its top level all the time.
It's fascinating, Don. You know, Intermountain is widely recognized as a leader in clinical quality improvement and in efficient healthcare delivery. And your program, which is just one part of Intermountain, but it's just a great example of why Intermountain is recognized that way. On behalf of the SMI community and the folks looking at this webinar, Don, we want to thank you for sharing with us today, and really appreciate it, and hope others can see your program as something that they strive to be as good as or better. So, Don, on behalf of everyone, thank you very much for today.
Dennis, thank you for the opportunity.
All right, Don, you take care. Bye now.